Hi, my name is Tom. In a moment, I'll tell you my story of having contracted an infection in my right knee after a total knee replacement. But just a quick disclaimer, I am not a doctor, and anything that I am telling you is just my own personal experience battling this infection. I had a total knee replacement in July 2024. Initially, my recovery was pretty smooth. By the end of the first month, the bend in my leg was excellent and I could walk a mile. However, at the 5 week mark, I noticed my recovery had plateaued. As time went on, I developed a low grade fever accompanied by night sweats. I also noticed a scab, which had been healing but was no longer getting any better. When I touched my knee, it felt much warmer than it had initially. Then by week 6, I just felt lousy. Naturally, I was concerned, so I gave my doctor a call. He saw me the next day and took some fluid off the knee to get tested. The results were not good. I had contracted a bacterial infection, which required immediate surgery. Within 12 hours, I was getting operated on to have the infection removed. Now, there are two ways to go about dealing with an infection after a knee replacement. One is to remove and replace all of the hardware that makes up the artificial knee joint. The other is less aggressive, where only the polyethylene spacer that is between the metal joint is removed. The decision on which way to go is determined by the surgeon, who takes into account several factors which are beyond the scope of this video. In my case, only the spacer was removed. After a protocol which involved debriding, cleansing, and disinfecting the infected area with antibiotics, I remained in the hospital for several days as they determined the bacteria that caused the infection. It ended up being a bacteria called Staphylococcus epidermidis, or Staph epi for short, which is normally a harmless bacteria that lives on our skin. It can, however, cause major problems if it inadvertently finds its way into the body, either during a major surgery or shortly afterwards. To make matters worse, this bacteria is attracted to foreign implants, such as an artificial knee. So, unfortunately, it can stick itself to one of the parts and then cover itself with a biofilm, making it tricky to get rid of. Once the bacteria was known, I was put on an antibiotic regimen for 12 weeks, during which I was prescribed 3 different antibiotics. One of them is called daptomycin, which needed to be injected every day for 6 of those weeks. To facilitate this, a PICC line was inserted to make it easy to do at home. Here is a photo of mine. The procedure to insert it was easy. It only required a single numbing shot. Then a thin, flexible tube was inserted into a vein where the white disc is located. It was then secured and covered with a sterile covering. And a quick note on that, if you notice excessive itching under the bandage, you may be having an allergic skin reaction to the bandage adhesive. That happened to me, so I let my nurse know, and it was replaced with another bandage that fixed the problem. The two ports that you see near the elbow are where blood is drawn and the daptomycin was injected. And I can tell you this absolutely beat the alternative of getting stuck with a needle every time either one of those occurred. I did experience side effects during the 12-week period. While 3 antibiotics were prescribed, I always took a combination of 2 of them during the 12 weeks, and it was hard on the body. I experienced a lot of fatigue, nausea, and chills. To combat the nausea, I drank a probiotic every day. But as far as the other symptoms, I just had to roll with them and take it easy. At the conclusion of the 12 weeks, I crossed my fingers in the hope that the infection would not return. The first week was awesome. I had finally felt like I got my life back. However, that would not continue long. During the second week after finishing the antibiotics, the same symptoms that landed me in the hospital the last time returned. I went through the same drill as the last time, contacting my doctor, getting knee fluid tested, which confirmed the infection, and then getting operated on the following day. This time, the doctor removed all of the implanted hardware and replaced it with a temporary joint called an articulating spacer. This beat the alternative, which involves placing a pad of antibiotics in the empty space where the joint was, then putting the leg in a splint for 2 months in a totally non weight bearing status. That would not have been fun. The articulating spacer allowed me to walk, and it also was infused with antibiotics, such that every time I walked, I was pushing the antibiotic into the bone. The only downside is that it was not nearly as good as a metal knee replacement. It just didn't feel as stable. Also, the body doesn't really accept it as a welcome addition. So that has been my case, and my knee has remained swollen throughout the post surgery period. This was expected, so it really didn't concern me much. Once again, it was found that I had the staph epibacteria in my knee joint. That was no surprise. In other words, the surgery to remove the infection and bacteria, followed by 3 months of harsh antibiotics, unfortunately did not rid my body of it. However, with the entire joint now removed, there were no longer any metal pieces for the bacteria to cling to. So the hope is that the daptomycin, which I had to be put on again with its accompanying PICC line, would finally get rid of it. I recently finished my last injection of daptomycin and I'm in a 14-day countdown, after which my knee will be retested to see if the bacteria is finally gone. If it is, I will have my knee replacement redone 10 days later, and I am confident this time that the results will be good. Before you go, I want to point out two important things. During your recovery from a knee replacement, if something doesn't feel right, let your doctor know. I mean, certainly your knee will be swollen, but is it overly hot to the touch? Do you have a scab that just isn't healing like the others did? Do you have a fever or night sweats or just feel like you're coming down with something? It may be nothing, but just be sure to let your doctor figure that out. I fortunately did not wait too long because not getting timely treatment for a knee infection can be very dangerous to your health. Also, since you won't be able to continue your normal routine, it's good to try to find some other outlets and some variety to help keep you centered, especially besides just watching TV. And if you ever start feeling down, as I have a few times during the past 6 months, just remind yourself that this will eventually end. And if it gets to be too much, talk it out with supportive family and friends or even a therapist. So I hope this video is giving you some good insight what to expect if you find yourself with a post knee replacement infection from someone who is currently going through it. I wish you the very best for a full, successful recovery.